I'm Callista.
And I'm Teresa, and this is Terrifyingly Typical True Crime.
This episode marks the beginning of our next true crime theme, female killer nurses. And because, terrifyingly, sorry I couldn't help myself, there have been more than a few nurses convicted of killing their patients, this is part one. We'll move on to another theme before returning for part two on female killer nurses, just so they don't all blur together.
It is terrifying.
I certainly think so. So, why would a nurse, someone who has dedicated their life to helping others, kill a patient? We've all heard of angels of death who claimed they kill to end someone's suffering, but some simply kill a patient they no longer want to work with. Still others harm those in their care to create a situation where they can play the hero when they later save them. Interestingly, since they are both medical professionals, there are unique reasons why a nurse, as opposed to a doctor, may turn to murder. Professor of forensic psychology Catherine Ramsland says that whereas doctors play into their power by acting as a god, nurses can feel overwhelmed and undervalued. So they'll kill to gain a sense of power, vent their frustration, alleviate their depression, attract attention, or as a way to revolt against a system they feel is stacked against them.
Professor Ramsland provided a list of 22 patterns a healthcare serial killer might display, including seeking out night shifts when fewer people are around, foreseeing a patient's death, frequently moving hospitals, preventing anyone else from seeing the patients in their care, and being connected to other incidents, such as when a higher number of patients die on a certain nurse's shift, which may be connected to a problematic disciplinary record. Criminologist David Wilson clarifies that only a person who checks five or more of these boxes should be given a second look. Unfortunately, that second look is rarely given. Kenneth V. Iverson, who wrote Demon Doctors, Physicians as Serial Killers,
Good title.
truly, noted that medical professionals often commit crimes in separate jurisdictions, and those around them make a habit of ignoring concerning signs again and again. Chuck on the lack of nurses in the US and the UK, and no one has the time to side eye homicidal medical professionals racking up victims under the radar. Historically, ignoring concerning signs is always beneficial.
Always. While some go into the field to gain access to victims, others become killers after they've gained their license and an understanding of their profession. Professor of criminology at Birmingham City University, Elizabeth Yardley, commented that they will have realized that hurting others gave them power and pleasure in the past, and that working in a hospital gives them the opportunity to recreate that experience. She noted that they feel their patients belong to them because they are under their control, which gives them the right to injure or murder them.
Dang, that's some twisted thinking.
I wonder if that's the mentality that those who hurt their partners or children have, like, they're mine, so I can treat them however I want.
I mean, maybe that really wreaks a course of control. Some people especially get off on the perceived, stronger, weaker dynamic. I am the medical professional. You are the weak, sick patient. I hold all the power over you.
Definitely. At first, I was somewhat shocked to learn that when it comes to healthcare providers charged with serial murder, and we should mention that they are rare, according to a 2006 study of 90 healthcare serial murders by Beatrice Crofts Yorker and Kenneth Kaiser, only 12% are doctors. And when it comes to criminal proceedings, 86% involve nurses, making nursing the profession most associated with murder. But that makes more sense when I learned that those statistics reflect the ratio of doctors to nurses in the workforce. I was less surprised to learn that 70% of murders occur in hospitals. However, attacks in outpatient clinics aren't unheard of, despite the risk associated with those crimes. In total, it's estimated that 60 patients are killed by healthcare serial murders every year. And although that's likely an underestimate, it's a staggering amount when you consider that around 150 murders are committed by all serial killers each year in the US.
These statistics are the stuff of nightmares. I'm actually not surprised the percentage of nurses who kill are higher than doctors since they are actually with the patients way more than doctors and have more access to, administer unprescribed or a lethal dose of prescribed medication.
Those are good points.
As for common traits of those who may go on to commit murder in a healthcare setting, they include problematic personal relationships, a mental or personality disorder, a current or past substance use disorder, seeking validation or overhyping their skills, and unsurprisingly, a criminal history. That said, it's rare for a healthcare serial murderer to have been caught committing crimes. Instead, it's much more likely they will have lied about their credentials. I mean, it seems like the HR departments are doing a crap job. And what type of criminal history does one have where they are still hired in a healthcare setting?
You would think that serious crimes would be disqualifying, but that's assuming they've been caught before.
Yeah. One Ontario nurse who had personality and mental disorders and who checked off many of Professor Ramlin's red flags, including frequently moving facilities and a problematic disciplinary record, was Elizabeth Wettlaufer. Today, we're going to look at the first known healthcare serial murder in Canada, who between 2007 and 2016 killed 8 elderly patients and tried to kill or harm 6 more. Given a life sentence in 2017 after confessing, the sentencing judge didn't believe Elizabeth's crimes would have been revealed if she hadn't admitted to them. After the failures of long term care facilities and the College of Nurses of Ontario came out, lawsuits were filed and an inquiry was launched as the public grappled with how this abuse of power was allowed to go on for almost a decade.
But were her crimes really that much of a shock? Not when you consider that victims of healthcare serial murders tend to be the most vulnerable, like the very young or the very old. And long term care residents are at high risk due to their possible cognitive decline and physical frailty that necessitates a high level of care. In these situations, there's a saying that no death is unexpected. And even when a death comes as a surprise, if there isn't a plethora of evidence or numerous black marks against a carer or facility, most don't give it a second glance. Beyond all that, as happened in Elizabeth's case, when few are eager to come work in a long term care facility, background checks are sometimes foregone, and problematic employees are given a pass.
That is so freaking scary.
That it is. It's true that no one is inclined to suspect those caring for them or their loved ones. You would hardly send your elderly family member to a care facility if you thought their caregiver would harm them. Yet, Elizabeth's story highlighted the reality that almost 70% of the victims of healthcare serial killers are elderly. What motivated her to take the lives of her patients? Let's hear it from the woman herself.
In 2016, middle aged Elizabeth Wettlaufer sat in slacks with her pink purse resting on the table between her and the detective. After they had broken the ice by discussing how much it cost to buy Toronto Blue Jays playoff tickets, Elizabeth said of her crimes, "It seems so stupid now." Having gotten up to collect herself, she continued by commenting, "Sorry, this is pretty major. I've only ever had parking tickets." Later in the interrogation, she described the red surge of pressure she felt in her chest that only lifted once she had given a patient an insulin overdose. Then it would be replaced by an elated, laughing feeling after the patient was dead. Wow, an elated, laughing feeling? I mean, WTF?
I know. She upsettingly, but I guess helpfully, doesn't hold back in describing how the murders made her feel. In this recorded interview that lasted over 2 hours, Elizabeth apologized for what the families went through and what they would go through once they found out their loved ones had been murdered. Knowing these apologies weren't enough, she admitted that she should have sought treatment earlier. But even though she seemed to understand the severity of her crimes and the deep pain they caused, she said that when she killed her patients, she believed God wanted her to, and only now realized that wasn't the case. She also stated that she wished she could go back in time and stop herself. In spite of the remorse that came after she finally received the treatment she needed, there is no excuse for the murder she committed, for the false sense of security she gave her victims when she told them, "The doctor wants you to have a vitamin shot," before injecting them with a fatal dose of insulin, all before returning home to press play on one of her computer games.
It's a special type of evil. I almost hope the patients were so ill that they were not aware of what she was doing and didn't suffer horrifying deaths, but that's probably not the case.
I really hoped so too, but unfortunately, insulin overdoses can lead to seizures, so not so much.
I mean, Jesus, it's just awful.
Mhm.
We can never excuse her actions, but let's look at Elizabeth's history so we can at least understand them. On June 10th, 1967, Hazel and Doug Parker welcomed Elizabeth Tracy May Parker to their family. She spent her childhood with her brother in a tiny farming community named South Zora Township near Woodstock, Ontario, which is apparently the most densely populated province in Canada. Glenn Hart, who lived across the street from Elizabeth, described the family as stuck in the 1950s. Her parents were domineering, and Hazel went along with whatever her husband said. Since Elizabeth's father was a local church elder, the entire family was expected to model his Christian fundamental beliefs. Those strict beliefs were on full display when Glenn came out in the 80s, and Doug and the rest of the Baptist church elders forced him out of the church.
Which I'm sure wasn't at all traumatizing.
I mean, way to look out for your congregation and love thy neighbor. Conservative religion has done more harm to people than being gay ever will.
Let's put that on a shirt. So, it was hardly surprising that there were strict rules Elizabeth was expected to follow. Yet, her time outside of the home was no more carefree. Due to being shy and socially awkward, she was the target of other kids' teasing. In the hope of changing how others saw her and ridding herself of the nickname Bethy, which is awful, she started going by Beth with an E at the age of 7. But this attempt to alter her situation wasn't successful, as the other children continued to pronounce her new name as Bethy. Because we're not her friends or tormentors, we're sticking with Elizabeth.
I would be curious of the percentage of kids that tease and bully others who grow up to be good humans.
I feel like without some kind of intervention, it's not high.
Yeah.
Elizabeth's high school experience was only marginally better. At Huron Park Secondary School, she was involved with choir, different school bands, and played goalie on the 1982 field hockey team. That didn't mean she was going out of her way to make friends, though. One incident that highlighted her less than magnanimous behavior was when she attempted to get revenge on a boy she didn't like by pulling the school fire alarm with the hope of blaming it on him.
Nice.
No red flags in sight.
And her forays into dating were hardly helping her self confidence. When she attempted to start a relationship with a teenage girl who lived in the neighborhood, the girl made it clear that she didn't return Elizabeth's feelings. Elizabeth was conflicted with her identity on multiple fronts. Her sexuality was one, but she also went from trying to atone for her previous mistakes to remaining true to herself, no matter the cost to anyone else, over the course of a few days. By the time she was in the 13th grade, the depression she would later be diagnosed with was creeping in. And as a quick side note, grade 13 used to be an additional year after grade 12 in some Canadian provinces, like Ontario. Now, Canadian secondary education ends after grade 12. Anyhow, Elizabeth's dark emotions were clearly reflected in the poem she penned for the school yearbook. One such poem, titled A Concert, that appeared in the 1986 yearbook, has the following lines, which we think sum up her nihilistic perspective and save us from going through the entire thing. The entire world's one giant concert, and we all make our own music. Each person's tune changes as he or she grows older, but it's all the same and inevitably pointless.
While the poem isn't earth shattering, to be fair, I know I felt similarly as a teenager, as I'm sure many people did at that age.
I mean, is there a teen that isn't at least a little angsty?
It's true. Originally, Elizabeth planned to pursue journalism after graduating high school. But after a year at university, she became bored with the subject and decided to learn more about guidance and mediation. This led her to getting her bachelor's in counseling from London Baptist Bible College, which is now known as Heritage Baptist College. Her father, Doug, was also taking classes at the same London, Ontario campus, which conveniently allowed him to keep a close watch on Elizabeth.
I mean, that is every kid's worst nightmare, especially when your father is ultra religious and controlling.
Too right. So, when Elizabeth was seen with her girlfriend at an LGBTQ plus friendly church, her father was able to send her back home. Elizabeth was forced to leave the college for a time. When apologizing and promising to never do something similar in the future weren't enough, Elizabeth was coerced into undergoing conversion or reparative therapy. Her family's attempts to change who she was, shockingly, contributed to her self loathing and depression. I know you feel the same way. I just feel a little bubble of rage burst in my chest every time I hear about conversion therapy.
I mean, it really is infuriating. I don't really want to know the specifics of conversion therapy, but you can't pray away the gay. It's just so harmful and damaging and makes me want to yell, people are born gay. It's not a freaking choice. Most people want to fit into society. Why would you choose to be gay and make life so much harder on yourself? You wouldn't because you were born that way.
And there's nothing wrong with that.
Despite having obtained her counseling degree, and I'm sorry, I just think counseling in Baptist college, I mean, hopefully, it would be advertised what kind of counselor you're going to, because I'm not sure that would be for everyone.
Yeah.
Elizabeth realized this wasn't the path she wanted to take and decided to go to Conestoga College in Stratford, Ontario to complete a 3-year nursing program. After she got her license to practice nursing in Ontario in 1995, she took temporary jobs at facilities such as the Victoria Rest Home and a social services agency where she helped those with disabilities. Soon, though, she started as a student nurse at Geraldine District Hospital, but she was later fired in 1996 for stealing and using lorazepam, a benzodiazepine. Is that how I say that?
Benzodiazepine.
Thanks. Which is part of a group of medications that depress the central nervous system. Xanax and Valium are two common types. Elizabeth would care for patients while on lorazepam and even overdosed. This marked one of the several times she tried to take her own life. Because of stealing and using medication, her license was suspended by the College of Nurses of Ontario for 6 months. With letters attesting to her recovery, she was then free to go back to nursing. On top of that, the College of Nurses of Ontario only kept a public record of this incident for 6 years. So by the time she applied to the nursing home where she would begin killing patients, it looked like she didn't have a disciplinary record of any kind, which is rather frightening.
More than a little bit.
To further cover up what happened, Elizabeth moved back to Woodstock, saying that Geraldton, which is 16 hours away, was far too remote. But while she was temporarily unable to practice nursing, Elizabeth worked part time as a personal support worker in several different care facilities.
Her personal life was on a similar roller coaster. Wanting to do what others, such as her family, expected of her, she married Donnie Wettlaufer, whom she met at a Baptist church in October 1997. The newly married registered nurse and local trucker started their married life in a small white bungalow near Woodstock's main street. This life was hardly idyllic, though, because throughout her marriage, Elizabeth's struggle with substance use disorder continued. She also underwent treatment for a borderline personality disorder, along with being associated with suicide, impulsiveness, intense emotions, and a negative self image. Borderline personality disorder is characterized by unstable relationships, often due to a fear of abandonment, something which Elizabeth's marriage was not spared from. In 2007, Donnie found out that Elizabeth had been contacting women online and that one of those connections had transformed into a romantic relationship. Hurt and confused, Donnie left Elizabeth and they soon divorced. But Elizabeth's relationship with one woman she had met online became serious, and they got engaged and started living in a two-bedroom apartment Elizabeth rented on the other side of the city near her parents.
Even now, Elizabeth's parents deny that she was romantically involved with any women. Hazel even called Elizabeth's fiance her roommate. She was renting an extra bedroom from the kind hearted Elizabeth. As for why her marriage ended, Hazel said it was because of Elizabeth's mental health struggles. She and Doug even called the incidents that littered her substance use disorder stress related episodes and medication mix ups. As much as her parents had their heads in the sand, there's no doubt that Elizabeth was under stress. For one thing, her mental health struggles weren't being fully addressed. Spanning the almost 10 years during which she killed her patients, Elizabeth had been regularly seeing the same psychiatrist. And in these monthly checkups, the psychiatrist would ask cursory questions before refilling her two medications, one for depression and obsessive compulsive disorder, and another that acted as an antipsychotic. Elizabeth would later claim that it was only once she was no longer on the antipsychotic in prison that the magnitude of the murders hit her. At the time, though, Elizabeth's imagination ran wild with visions of killing her coworkers and her psychiatrist.
To add fuel to the fire, Elizabeth's stress increased in June 2007 when she began working at Woodstock's Crescent Care, the first of many long term care facilities in order to support her, her fiance, and her fiance's two children. She looked to nursing as a way to pay the bills, and Crescent Care, the largest care home in the area, was offering her financial security, something she wasn't used to in the form of a $60,000 annual salary. By this point, Elizabeth had been a nurse for more than a decade and was well versed in taking care of patients with blood sugar problems, which included treating them with insulin. Crescent Care was one of numerous long term care facilities that didn't lock up or track their insulin supplies.
What bright mind thought that that was a good idea?
And then no one pushed back on it. In addition to being in charge of doling out medication, Elizabeth often worked night shifts, a previously mentioned red flag. She had 32 elderly patients in her care during the day and 99 at night. It's almost unbelievable that she was the sole person in charge of nearly 100 patients,
It's a joke. I wonder how many patients died simply because they weren't being adequately monitored.
which you couldn't blame the non murderous nurses for.
True.
They didn't make that idiotic decision. However, it's easier to see why that was the case when you consider that finding and keeping nurses at long term care homes was such a struggle. Even if it wasn't malicious, something was bound to happen.
Exactly.
And it did, because only weeks after starting at her new place of employment, Elizabeth began to see the residents as victims. Something that wasn't helped by her habit of working a double shift from 3 in the afternoon until 7 the following morning.
I never understand allowing nurses to work a double shift. I mean, it would be a lot to work that many hours. I don't know, as a convenience store, but I would argue fatigue, exhaustion, and general crankiness is a lot more of an issue at a care home.
I would also argue that people make mistakes when they're tired, so pushing healthcare workers to their limits isn't a good plan.
Yeah, let's make everybody suffer. That seems like a good idea.
Mhm.
But with the great responsibility, Elizabeth gained a level of control that she had previously struggled to obtain. She now had the power to decide who deserved to live. As for those she decided didn't make the cut, she started trying different doses of insulin to see the amount needed to commit murder. With each attempt, she proved to herself how simple staying out of prison would be. The role of Carescent would allow her to kill 7 patients by administering an overdose of insulin, which she knew wasn't as closely monitored as other medications, like narcotics. In fact, 52% of healthcare murderers opt for injectable medications like insulin, potassium chloride, or opioids because they can be difficult to detect after death. And in the case of insulin, there is no way to test for hypoglycemia, the low blood sugar insulin causes after death. On top of that, someone could be injected with insulin and only die from the overdose days later. And differentiating between synthetic and natural insulin is no easy task after someone has died. And if no one believes it was an unnatural death, evidence is discarded when the cleaners unknowingly take apart what is actually a crime scene. That's not to mention that laws put in place to protect patient privacy can hinder investigations. With all of these points in her favor, Elizabeth's patients were thought to have died naturally. Again, I think this is like the third time I've said it, but it's so freaking scary.
It truly is. Besides this method of murder resulting in no raised eyebrows, insulin injections were simple. All Elizabeth had to do was put an insulin cartridge into an insulin pen, which had a dial on one end and a needle on the other. She made a practice of dialing up. This saw her using the pens to inject huge quantities of insulin. By administering it in a spot no one would notice, as the insulin running through the patient's veins caused them to go into hypoglycemic shock when their blood sugar plummeted. Although another nurse would occasionally verify that the dialed up dosage aligned with the amount the patient was supposed to be receiving, Elizabeth could often get away with dialing up to 15 on a cartridge with 120 units of insulin at the nurse's station before moving away to dial up to 65, more than 4 times the expected dose. And while the box containing the insulin cartridges had the patient's name on it, the cartridges themselves did not. With extra pens just lying around and no one batting an eye at the rate they were going through insulin, Elizabeth was almost untouchable.
In the 6 month span between June 25th and December 31st, 2007, Elizabeth attempted to kill her first two patients at Carescent Care. It was a way to relieve the stress she was under in both her personal and professional life. So she decided to give it a go to see what would happen. Fortunately, despite giving Clotilde Adriano and Albina Demidatros insulin injections, neither died from them. Only days after starting at Crescent, Elizabeth dialed up and gave 88-year-old, Clotilde Adriano, who was struggling with dementia, a massive amount of insulin. Luckily, the other employees noticed her reaction and were able to stabilize her blood sugar levels and save her life.
Elizabeth would later claim that she hadn't truly wanted Clotilde to die, but that she felt that God wanted to use her. She said that she felt that God wanted Clotilde with him. I was tempted to say Elizabeth wasn't thinking clearly, and that's true to an extent, but no one can deny how calculated her killings and attempted killings were, because every single person she went after had dementia. And the reason she made sure of this was so if they managed to report Elizabeth, everyone would believe Elizabeth instead. Which is really kind of evil. I don't think there's another way to describe using someone's illness against them.
It sure is. It's evil and calculating.
Yeah. After failing with Clotilde, she tried with Clotilde's sister in law, Albina de Medeiros, who was also at Crescent. She, like her 88-year-old family member, luckily didn't die either. But Elizabeth would manage to kill her first patient that year.
On August 11th, 2007, only 3 months after coming to Crescent, Elizabeth gave new resident James Silcox a fatal insulin overdose. James was an 84-year-old World War II veteran who used to go to church every Sunday, but had become immobile after a stroke. When Elizabeth began her double shift that summer day, James was confused, unaware of where he was, and yelling for his wife Agnes. In her eventual 4-page handwritten confession, Elizabeth admitted to the anger she felt towards her victims, including James Silcox. She wrote, "At approximately 7:30 p.m., I decided to overdose him with insulin, hoping he would die." She claimed that the octogenarian, who was also struggling with diabetes and Alzheimer's disease, had occasionally behaved inappropriately. And I'm sure he did. He had a host of ailments. Dementia is going to cause him to act out.
True, and also not a reason for murder.
Yeah, around 9:30 p.m., Elizabeth acted on her rage.
She went down the hallway to the medical storage room where she inserted the cartridge into the insulin pen. She had learned from Clotilde and Albina because she gave James 50 units of quick acting insulin, double the amount she had used on her two prior attempts. Elizabeth said that after she gave him an overdose, he cried out apologies and expressions of love throughout the night. It's unclear to whom he was speaking, but given his earlier cries, I would guess he thought he was speaking to Agnes.
It's really heartbreaking.
Truly. But despite the shame that plagued her, Elizabeth felt relieved after the overdose. Before we talk about her other victims, let's go back to Elizabeth's personal life. Because by early 2008, her engagement had ended. Elizabeth now felt more than comfortable using the internet to find a partner, and she used it to meet Sheila Andrews, who was a prison cafeteria worker. After their initial connection, Sheila invited Elizabeth to come spend a week with her in Prince Albert, Saskatchewan that summer.
Far from being conflicted about her sexuality, as soon as Elizabeth walked off the plane in a summer dress, she bombarded Sheila with affection and was eager to move forward in their new relationship. She had even told her coworkers all about their future together. But after spending the night together in a motel close to the Saskatoon airport, Sheila became more and more convinced that she needed to get out of this relationship. Elizabeth's immaturity was on full display to her new partner. If Sheila didn't show her the same level of affection, for instance, Elizabeth would pout and rage at her. Elizabeth would talk at length about her job responsibilities, about the fact she was the one responsible for the patients at night. But she wasn't sharing her pride in helping those in her care. Elizabeth was reveling in the power she held. Her lack of compassion was all the more evident when she declined to meet Sheila's elderly mother, who was currently in the hospital.
At the end of Elizabeth's stay, Sheila made it clear she didn't want to continue the relationship. So Elizabeth did what so many had done before her. She channeled her resentment into her poetry. Under the pseudonym Betty Weston, Elizabeth shared her poems online on a site called allpoetry.com. While some were innocent, many of the less than cheerful poems she wrote discussed her professional and personal struggles, her romantic relationships, and murder. One seemed to hint at what she was doing to her patients, reading, quote, "Where am I left then? What would they say? Yes, what will they say when the real truth is known? When it is found out, what I do alone." Again, she may not be setting the world on fire with her writing, but that certainly sent a chill up my spine.
Yeah, me too.
And Elizabeth had no plans on stopping. On December 22nd, 2007, still in her first year at Crescent, Elizabeth dialed up another insulin pen and killed 84-year-old Maurice Granot. She then attempted to kill Michael Priddle and Wayne Hedges between 2008 and 2009, but fortunately both survived. However, by December 2011, she had killed three more Crescent residents: 87-year-old Gladys Millard, 95-year-old Helen Matheson, and 96-year-old Mary Zurowinski. And because Elizabeth was the one who was supposed to tell authorities about suspicious deaths, and the one tasked with completing a checklist detailing whether anything improper may have resulted in a patient's unexpected death, no autopsies were conducted and nothing suspicious was noted.
I mean, it seems like maybe that should have been a two-person job.
Seems like maybe some oversight wouldn't have gone amiss.
Yeah. However, that didn't mean Elizabeth wasn't worried about being caught. The day after murdering 96-year-old Mary Zerwinski, Elizabeth went to Florida with an ex girlfriend on November 7th, 2011. Despite having ended their relationship weeks earlier, they decided to go ahead with the Caribbean cruise they had signed up for. Upon disembarking back in Canada, they went to see a friend who lived near Toronto named Trish Crosby. Trish remembered that while Elizabeth was acting normally when they first arrived, she later became reserved and confessed it was because of the recent death of a resident. Trish said that Elizabeth was normally very needy, always trying to get the attention of those around her. But on this occasion, she withdrew into herself. Although Elizabeth wouldn't talk about what exactly had happened, Trish thinks Elizabeth may have been reliving what she had done.
But Elizabeth wasn't only preoccupied by her crimes. Her substance use disorder was also always front of mind. Even though she claimed that she was never under the influence at work, in spite of her earlier termination, we might add, a coworker at Crescent said they had found Elizabeth unconscious in the basement of the building during one night shift. And she may have said she was never using on the job, but Elizabeth did admit to taking large amounts of hydromorphone and opioid pain reliever numerous times per month to get her through. Hydromorphone can be found at any care facility, and although Crescent claimed to have tracked its supply of hydromorphone more closely than its insulin, Elizabeth had mastered how to use her patient's supply. When one of her patients was prescribed medication, she would take advantage of the confusion they experienced by either switching their hydromorphone with a laxative or breaking the capsule open, swallowing the opioid, then handing over the empty capsule to the patient. None of her patients noticed a thing.
And they continued to be in pain because she took their medication.
Exactly.
Elizabeth would also steal the narcotics of recently deceased residents. One patient who had just passed away left behind 23 hydromorphone pills in a medication case for Elizabeth to swipe. Elizabeth noted when new drugs were set to be delivered, and if someone failed to immediately stow them in the safe, she would pocket them and bring them home with her. Often months went by before the rest of the staff realized there were drugs missing. And when the police were finally alerted to the theft, Elizabeth simply acted as if she had no idea what had happened. Like murder, the stolen hydromorphone relieved the red surge of pressure Elizabeth felt. This substitute for killing patients allowed Elizabeth to stop for nearly 2 years. But by the summer of 2013, the pressure had returned, and Elizabeth once again acted on her desire to take the life of a patient.
This time, Elizabeth chose to murder 90-year-old Helen Young. Helen was born in Scotland and met her husband when they were both serving during World War II. Fond of animals and traveling, Helen moved to Woodstock with her husband in 1971. Elizabeth would later tell police that Helen, who was once again struggling with dementia, was hard to care for and always yelling for help. So, on July 13th, 2013, right before dinner was scheduled to be served, Elizabeth retrieved two insulin pens and dialed them all the way up. The double overdoses Elizabeth gave to Helen took their effects over the next 3 hours. A seizure racked her body, her eyes bulged, her face flushed red, and her limbs jerked towards her body. By the time the sun made its ascent the next day, Helen was dead. Elizabeth outwardly comforted Helen's devastated niece, hugging the crying woman and murmuring consolations. On the inside, though, the elated laughing feeling that had replaced the red surge of pressure felt like the uninhibited cackling from the pit of hell.
This demonic sensation was also sometimes accompanied by, if not guilt, at least the urge to confess her sins. This urge saw Elizabeth driving to her pastor's home that summer. She had been a member of Woodstock's multi denominational family church, so seeking out her spiritual leader and his wife to lighten her load seemed like the next right step. The pastor and his wife prayed for Elizabeth and told her that if she killed again, they would go to the police. The pastor later claimed that he wasn't sure if Elizabeth was telling the truth or not.
I think that sounds like ass covering, but maybe I'm just jaded.
No, I agree with you. It's not like a teenager saying that they want to kill their younger brother. I mean, that too is messed up, but certainly easier to shrug off as opposed to a grown ass adult confessing to a pastor. That doesn't seem very godly, Pastor. Don't all lives matter? Isn't life precious?
Maybe only when it wouldn't be inconvenient for him to take action.
I mean, there might be paperwork, there might be driving, phone calls.
It would take time.
Yeah. By the end of March 2014, less than a year after Helen Young's murder, Elizabeth had killed again. This time she went after 79-year-old Maureen Pickering, having moved around Toronto and Tillensburg, Ontario. Maureen had enjoyed visiting Florida following her husband's death, but by the time Elizabeth met her, she was too ill to travel.
It was only in the days following Maureen Pickering's death that Elizabeth was finally fired for several medication mistakes, because at this point, four Crescent residents had survived unforeseen hypoglycemia, and Elizabeth had been suspended not once, not twice, not thrice, but four times for giving patients the wrong medication. These weren't insulin overdoses, but the patients were still harmed. Only weeks after being fired, Elizabeth attended an interview for a position at London, Ontario's Meadow Park Long Term Care that would require her to care for around 120 residents. After Elizabeth admitted that Crescent had fired her for making medication mistakes, the nursing supervisor assured Elizabeth that she believed everyone deserves a second chance and handed over a 1 year contract which would have Elizabeth once again working night shifts.
No, no, no. She did not deserve a second chance. It wasn't one mistake, it was four. My God, people, at least attempt some due diligence.
I'm all for giving people second chances. Well, I'm not really, but for argument's sake, I'll pretend. But let's at least not give them the opportunity to make the same mistake when nothing has changed.
Even though Meadow Park said that it verified both Elizabeth's references and her status with the College of Nurses of Ontario, only a month after she signed her contract, she killed her eighth and final patient, Arpad Horvat, in August 2014. The 75-year-old married father of two was spending his final days at Meadow Park when Elizabeth set her sights on him. He died of a stroke after Elizabeth gave him an overdose of insulin. In her later recorded interview, Elizabeth would claim that all of her victims died peacefully, which is hard to imagine because after Elizabeth administered the insulin overdose, some patients would stroke out, meaning that they would foam at the mouth as their bodies contorted. Slowly, their vital organs would shut down. Sometimes death would come quickly within a few hours, which to me doesn't seem quickly. Quickly is like 2 minutes. But,
Yeah.
anyways, but other times the patients would lie in a vegetative state for days before death finally claimed them. So, not peaceful.
Not so much, and I don't think anyone could describe Helen Young's seizure as peaceful, even though Elizabeth had previously been fired for the second time from Crescent for misusing medication, incompetence, and unprofessionalism. With the help of the Ontario Nurses Association, ONA, she managed to leave without a single mark on her record. At first, I fully thought the ONA was going out of its way to protect one of their own, but actually, at the time, legislation ensured that records of prior incidents and disciplinary actions could not be disclosed to future employers, which is crazy to think about. Obviously, people make mistakes, but it's legislation like this that allows healthcare professionals to kill with impunity.
Exactly. This is life and death. It's not like Joe was consistently late for his job at Burger King, and there is special legislation so that when he applies at Dairy Queen, they won't know about his tardiness.
That's great, and 100%. Beyond that, Crescent Care was prevented from telling other employers about Elizabeth's history and what led up to her termination. And surprise, surprise, another resident went on to die at her hand.
I mean, it's asinine.
It's ridiculous. Not long after killing this final resident, Arpad, Elizabeth sought help for her substance use disorder after she overdosed.
Which is great, but her substance use disorder did not cause her to kill her patients.
There is undoubtedly something else at play. She left Meadow Park and her mother took her to a Port Colborne, Ontario rehabilitation facility at which she stayed for nearly a month.
Almost 2 months after leaving the facility, by the beginning of 2015, Elizabeth was once again nursing elderly patients as she worked in various part time roles at care facilities around Woodstock. At Paris, Ontario's Telfer Place, Elizabeth attempted to kill Sarah Taller, a 77-year-old with dementia, by giving her an insulin overdose in September 2015. Even though Sandra went into hypoglycemic shock, other employees found her in time and managed to save her life. Less than a year later, in the summer of 2016, Elizabeth contacted Sheila Andrews, the woman she bombarded with infection and Saskatchewan via Facebook Messenger, to once again tell her about her work. But this time, she reached out to share her struggles, admitting that she had problems changing the dressing of an IV line to a patient's heart. Concerningly, Elizabeth had contaminated the sterile field and misplaced things. Is there mandatory continuing education for nurses?
I looked it up. There sure is.
Ugh.
The patient Elizabeth had told Sheila about struggling with was most likely Beverly Bertram, a 68-year-old living as a recluse with her partner in public housing in Ingersoll, Ontario. But Elizabeth hadn't only bungled a dressing change. She had used insulin, prescribed to another patient, to inject a fatal dose into the catheter in Beverly's arm in August 2016. Beverly Bertram was the only one of Elizabeth's victims to see her sentenced. The rest, sadly, previously passed away. Beverly admitted, I still have nightmares. I still don't like people coming in my house. I have no friends except for my workers because I don't trust people at all. And who can say they'd feel differently after almost being murdered by their trusted nurse?
Poor Beverly. I don't trust people either, but I certainly wouldn't trust people if I was in Beverly's position.
Yeah. Elizabeth was hopping from one temporary role to the next with one of Canada's oldest nursing agencies, St. Elizabeth Healthcare, in the summer of 2016, when the agency gave her the opportunity to care for children with diabetes at an Ingersoll School program in which she would monitor their insulin pumps and ensure their dosage was correct. Elizabeth knew she would likely kill again, so she not only turned this offer down, but she also quit nursing altogether on August 29th, 2016.
Was this introspection?
Or something.
Feeling like time was running out, Elizabeth left her apartment one summer day to knock on one of her neighbor's doors, that of a man named Wade Messenger. Wade believed Elizabeth had previously vandalized the lock on his door, his son's stroller, and Wade's bicycle. It was safe to say he wasn't her biggest fan. Although he had disliked her for years, he hadn't failed to notice that she had recently been working less. So when she showed up in his doorway looking unwell and asked the neighbor she knew used medical marijuana or his glaucoma for something to get her through morphine withdrawals, Wade warned her this was a one time deal and sent her on her way with a joint. But Elizabeth's time hadn't run out quickly. Over the course of 9 years, Elizabeth had confessed to multiple people that she had harmed patients. She had told not only the pastor and his wife, but also an ex girlfriend, a student nurse at Crescent, an ex boyfriend, a lawyer, and her sponsor.
She confessed to her girlfriend at the time about killing her first two patients in 2007. Her girlfriend told her to stop to avoid getting caught, although Elizabeth later said she wasn't sure if that was a flippant remark made due to not believing her. Elizabeth then told a teenage student nurse taking on shift work at Crescent in 2011, then the pastor and his wife, as well as an ex boyfriend in 2014. This ex boyfriend allegedly asked Elizabeth to leave her job to prevent herself from acting on the impulse again, and he in return would drop his wife and take care of Elizabeth instead. A few months after that, Elizabeth confessed to a lawyer following treatment for an overdose on the hydromorphone she had stolen from Meadow Park. Finally, she told her Narcotics Anonymous sponsor later in 2014. Her sponsor simply laughed off what she thought was a joke.
When someone tells you what they have done, believe them.
Right? That's four confessions alone in 2014. And while some of these confidants said they'd contact the authorities if they found out that she had murdered someone else, some didn't believe her at all. The same ex girlfriend, for instance, didn't give it a second thought when Elizabeth said she dreamt of murdering people. What none of them did, though, was go to the police on the woman they knew could be compassionate and funny, but also deceitful and controlling. And I almost feel like I give those who didn't believe her more of a pass than those who said they'd go to the police if she killed more people. Because what? Do we have to get to a certain number of murders before it's worth bothering to tell authorities? Who thinks like that?
I mean, is it too much effort to do the right thing? Is killing one or two people okay? You get a pass for that, but three is too many?
Yeah, I'd like to know the number.
Nearly 2 weeks after turning down the role caring for children with diabetes in Ingersoll, Elizabeth voluntarily admitted herself to Toronto's Centre for Addiction and Mental Health, CAMH, which is the largest mental health teaching hospital in Canada, on September 16th, 2016, later saying that part of me started to believe I was the devil. Me too. Elizabeth knew without a doubt that she needed intensive psychiatric care, the kind of care she hadn't been receiving from her psychiatrist of nearly 10 years. Again, good job.
Mm-hmm.
So, so she got a friend to care for Nashville, her Jack Russell Terrier, packed a suitcase, and left her apartment for the last time. She took a train from the Woodstock station and signed herself into CAMH's emergency ward almost 2 hours later. In addition to her opioid addiction, Elizabeth had struggled with alcohol use disorder for years. Staff at CAMH also diagnosed her with antisocial adult behavior, major depressive disorder, and borderline personality disorder. Yet, as stated in court documents, these diagnoses never prevented her from distinguishing right from wrong. As for how they developed, some of her symptoms worsened after her husband, Donnie, left, but Elizabeth had likely developed antisocial personality disorder around the age of 15. Psychiatrists also noted that because of her strict Baptist childhood, Elizabeth, a regular parishioner, felt conflicted about her feelings towards God.
When it came to her take on how her substance use disorder affected her work, Elizabeth admitted to taking the form of medication of deceased patients from a safe. However, she claimed that she was not under the influence when she killed. An interesting choice, since she could have gotten a lighter sentence if her intoxication was deemed a mitigating factor. Something else that's interesting is that when Elizabeth told police that she would steal Dilaudid, which is the brand name for hydromorphone, from patients and use it for herself, she said, I was always putting this pressure on myself to be a really good nurse and do everything perfectly. After taking half a pill, that pressure was gone. This feeling of relief and release is the same way she described how she felt after killing a patient, when the red surge of pressure lifted once she had given them an overdose. This comparison seems to indicate that, for her, murder was a compulsion, just like those associated with her substance use disorder. And as we already saw, this chemical substitute for murder stopped Elizabeth from killing for almost 2 years. But this wasn't her first time in a rehabilitation facility. Elizabeth's stay at CAMH in 2016 was her second stint. She had first undergone treatment in the fall of 2014, weeks after she killed her final patient, Arpad Horvath, in August 2014, then overdosed and sought help. And maybe it helped for a time because Elizabeth waited a year to try and kill another patient, by which time she was using once more. Luckily, her attempt to take Sandra Taller's life in September 2015 was unsuccessful.
Back to why the second stint was so eventful. Upon being admitted to CAMH in 2016, Elizabeth continued confessing, later saying that she recognized that she needed help to stop. Over the course of 20 days, she told everyone around her that for almost a decade, she had taken out her feelings of rage on the patients in her care. Her psychiatrist, Dr. Alan Kahn, recommended that she write it all down, but didn't mince words about the fact that her statements would finally be taken to authorities. This would turn into the 4-page handwritten confession we mentioned earlier that listed her victims, or at least their first names, because she couldn't remember all of their full names, along with the minutiae of how and when they had been murdered. The overwhelming tone of the confession was not remorse, but relief. Throughout these 20 days of treatment, Elizabeth also contacted those unaware of the situation, like her childhood neighbor, Glenn Hart, whom through Facebook message she told that she had killed several patients on purpose. When asked why, she replied, I had some anger issues that I had to deal with, some really major anger issues. I think that I was acting out my anger issues on these people. Glenn didn't know that CAMH had already alerted the authorities and encouraged Elizabeth to tell the police.
CAMH first went to Toronto Police, then to the College of Nurses of Ontario, which is the province's regulatory body for nurses. The first time Toronto Police questioned Elizabeth was on September 29th, 2016. They went to see Elizabeth at the center and brought her to the local station to provide a recorded statement. They then contacted police in Woodstock, and authorities there and in London worked with the Ontario Provincial Police's homicide detectives. The following day, Elizabeth confessed her crimes to the College of Nurses of Ontario and handed over her license. A nurse no longer, she left CAMH on October 5th, 2016. With her confession in hand, authorities were sifting through pages of medical records and death notices to find the full names of each of Elizabeth's victims, finding that in each case, nursing logs proved that Elizabeth was in their vicinity when the overdose occurred.
Elizabeth knew she wouldn't be a free woman for much longer and didn't fight a court order that forbade her from stepping foot into a long term facility or having access to any insulin. And she was right because the police were doggedly continuing their investigation. They were busily ransacking her apartment to carry away any piece of evidence they could possibly use, which included bringing her computer back to the station. Elizabeth wasn't worried about what they would find, though. She was most concerned about what would happen to her home and possessions. She didn't keep these concerns quiet either. She explicitly asked a detective if she would be returning to a mess. Way to understand what is important.
Gotta prioritize.
Despite the remorse she had shown in her interview, the one with which we started the episode, it wasn't stopping her from living her life in the days before her arrest. Even those around her knew something was going on, since she had to live with her parents and was under a restriction of some kind.
But when two women from her apartment complex joined Elizabeth at a steakhouse, Elizabeth downplayed the entire situation. Laughing and joking throughout the dinner, her companions had no clue that they were eating with a murderer. Elizabeth even joked about the police officers coming around and asking questions, saying, "I like police in uniform, and they don't scare me at all." 3 days after this jovial dinner, on October 24th, 2016, the 49-year-old was finally arrested. Beyond the 8 murders, Elizabeth was also later charged with 2 aggravated assaults and 4 attempted murders via insulin overdoses. As for these latter charges, on the final page of Elizabeth's previously mentioned handwritten confession, she had printed their names and the related dates beneath the chilling title, People Who Didn't Die.
That is chilling.
Hmm. As for those who didn't die, the assaults marked when Elizabeth had given Albina de Medeiros and Clotilde Adriano insulin injections soon after starting a crescent, which both survived. Clotilde didn't die until 2008, a year after the overdose, and Albina only passed away in 2010. And the attempted murders were related to Michael Priddle in 2008, Wayne Hedges in 2009, Sandra Taller in 2015, and Beverly Bertram in 2016.
Elizabeth pleaded guilty on June 1st, 2017, to 4 counts of attempted murder, 2 counts of aggravated assault, and 8 counts of first degree murder, thereby avoiding a trial. However, a sentencing hearing took place on June 26, 2017, that allowed victims and their families the opportunity to give impact statements to the court. Gladys Millard's niece said it was like her aunt died twice, once in 2011, then once again in 2016, when it came out that she had been murdered. Her aunt had been born in New Glasgow, Nova Scotia, and she and her husband later moved to Woodstock. Gladys had 2 children and was involved with her church as well as various service organizations and charities. Now, as all the victims' family were forced to do, her niece was left to reconcile the fact that the woman she had loved hadn't died naturally and she might have had more time with her if it hadn't been for Elizabeth. The majority of those left behind detail their experiences with depression, grief, and guilt for not realizing their loved ones were in danger. Helen Matheson's daughter said, "I placed my mother in the care of a facility I researched, never thinking she would be the victim of a despicable crime." Mary Zerwinski's granddaughter had been excited for her grandma's 100th birthday, from which she was only 4 years away. The family expressed their feelings of hatred, but said they, as Christians, would attempt to forgive Elizabeth.
Good on them if it helps them heal, and hopefully, every friend and family member will come to realize that they were not the ones to blame.
Of course, they aren't to blame, but I can understand their guilt. If they can attempt to forgive Elizabeth, they're better people than me.
Same. Elizabeth, for her part, looked away from the families of the victims to read a pre written statement from the prisoner's box that said, I have caused horrendous pain. Sorry is much too small a word. I hope that the families can find some peace and healing. She had previously said in her confession, when asked about a tattoo on her chest reading hopes and dreams, that her hopes and dreams for the future are that somebody can study me and come up with answers and new medications so this doesn't happen again. Elizabeth's perception of killing as an addiction harkens back to a theory proposed in the 1980s and 90s when gambling addicts were compared to multiple murderers. Previously mentioned professor of forensic psychology, Catherine Ramsland, noted that dopamine and the brain's reward system are linked to the compulsion to kill. And James Fallon, a neuroscientist, argued that hormones accumulate in the amygdala, which is where behavioral and emotional responses are regulated, of serial murderers that cause them to go into a withdrawal after one murder, which leads to the next. Which still doesn't excuse their actions, but it does offer one way to explain them and a possible avenue of prevention to explore.
Elizabeth was sentenced to life in prison by Justice Bruce Thomas. He decided to have her serve her 8 life sentences concurrently and not become eligible for parole until 25 years had elapsed, instead of opting for Elizabeth to serve consecutive terms that would have amounted to around 200 years. Justice Thomas believed that her crimes would have never come out if she herself hadn't confessed to them, so he chose to give her concurrent sentences. Throughout her sentencing, Elizabeth showed no emotion. She was then sent to Milton, Ontario's Vanier Centre for Women, where she could apply for parole as early as 2041. Justice Thomas does not believe it will be approved. He even described Elizabeth as a shadow of death that passed over them on the night shift where she supervised.
I thought that really exemplified the specter Elizabeth became to those she was entrusted to care for.
Yeah. In spite of her admission of guilt and current residence at Kitchener, Ontario's Grand Valley Institute for Women, Hazel Parker has downplayed her daughter's crimes, even saying that she could have never confessed to her crimes, as if that one somewhat decent action in some way excused them. Hazel said that the fact that Elizabeth tried to do the right thing has been disregarded.
I don't think that's true. I think her confession has simply been overshadowed by the magnitude of her crimes and their continued effects. But Hazel, as she did with Elizabeth's sexuality, is still presenting the version of the story with which she is most comfortable.
Hazel is in denial and needs therapy that she will never seek.
It does seem like some of the people who need it most are quickest to reject it.
Definitely. Elizabeth's case left many distrustful of Ontario's long term care system. And before Elizabeth was even sentenced, numerous advocacy groups appealed for answers and inquiries from the College of Nurses of Ontario and Ontario's governing bodies. Why were they not calling for national action? Well, as in the US, where healthcare is regulated state by state, each Canadian province or territory regulates healthcare in the area, so Ontario was firmly left holding the bag.
In the July 2017 disciplinary hearing conducted by the College of Nurses of Ontario, they permanently revoked Elizabeth's nursing registration. Elizabeth was not present to hear that she would never again practice nursing in Ontario. Something else that came out of this hearing was Elizabeth having been fired from Geraldton District Hospital, then being temporarily prohibited from nursing. Why do we say this came out? Well, because Elizabeth had been lying about her employment history for years. Elizabeth forgot to mention her time at Geraldton District Hospital, along with the investigation into her by the College of Nurses of Ontario, on all her later job applications. She teamed up with the Ontario Nurses Association to reach a settlement with Geraldton District Hospital and Crescent Care that resulted in them not only renaming the terminations as resignations, but she also got letters of recommendation from them and received $2,000 in damages from Crescent Care, all so that the facilities wouldn't face a grievance from the Ontario Nurses Association. Rightly, this left many people wondering if the College of Nurses of Ontario was able to properly regulate its nurses.
I mean, that's some crazy CYA going on. Every kid doesn't get a trophy. Firing is different than resigning. Do you want people to die?
It doesn't seem like that is the biggest concern, does it?
Wow, what is wrong with these organizations?
Mhm.
Apparently, Crescent Care had told the College of Nurses of Ontario about Elizabeth's medication mistakes when she was fired in 2014. Yet, in spite of having thus far killed 7 people, the college said Crescent employees had no significant concerns, so they took no further action beyond filing away her termination notice. However, Crescent denies the college's story, claiming that they did file a 20-page document detailing their concerns, but that the college never did anything with it.
Which sounds like ass covering all around.
Sure does. Soon after Elizabeth was sentenced, the Ontario government told the public an inquiry would be conducted to examine the long term care system to understand how the murders were allowed to happen in spite of Elizabeth's record. This inquiry started in August 2017 and uncovered that Elizabeth's coworkers had started raising concerns about her in 2012. Yet, despite voicing these concerns, many employees at long term care facilities did not realize they were supposed to report concerns of any possible neglect. Really?
It does seem like that would be rather obvious since you are literally responsible for people's lives. The final report on the public inquiry into the safety and security of residents in the long term care home system came out on July 31st, 2019. Ontario Court of Appeal Justice Eileen Gillis gave 91 recommendations in this 4-volume report, upon which the victims' devastated friends and families had pinned their hopes of change. These recommendations included a better system of tracking and storing medication and increased staffing and funding for the long term care facilities in Ontario. 9 recommendations also specifically targeted the College of Nurses of Ontario and included improving the education of staff on healthcare serial killers and mandatory reporting. Even though her report identified where the system went wrong, Justice Gillis didn't let Elizabeth off the hook, as in her report she stated that Elizabeth murdered her patients for her own gratification and for no other reason. She also agreed with Justice Thomas that her crimes would have never come to light if she hadn't admitted them. She dedicated her report to the victims and their loved ones and asked that those left behind received free counseling services for 2 years.
The families of 84-year-old Crescent resident James Silcox and 75-year-old Meadow Park resident Arpad Horvath filed independent lawsuits against Elizabeth as well as the facilities that employed her. Susan Horvath, Arpad's daughter, also implicated the Ontario Nurses Association, who had gotten Elizabeth a settlement with her former employers. When Crescent Care's facility in Woodstock was banned from accepting any new patients in January 2017, following an inspection that identified multiple issues. Crescent employees said this allowed them to care for patients in the way they deserved, something they hadn't been able to do for years. However, the facility was allowed to resume admitting patients in December of that year.
We wanted to end with a quote from a lawyer for the Advocacy Center for the Elderly called Jane Meadus, who said, quote, "People in long-term care homes need to be treated as people. We heard a lot about how most people think this is a place for people to go and die. And that attitude creates some of the problems because people aren't being treated as human beings. Long term care should be seen as a vibrant place where people can live and contribute."
3 cheers for Jane. I completely agree.
Yeah, I think that pretty much sums up how we think of the elderly, at least in the US, and that seems to be the case in Canada too. If you can't work, you're worth less. Long term care facilities are seen as places for people who are already knocking on death's door, those who are too ill or old to be regarded as fellow human beings. And of course, I can understand why it's difficult to find and keep employees because some residents may be difficult. And on top of that, you're going to be faced with a reminder of your own mortality on every shift. But residents deserve better. Elizabeth, no matter her struggles, inexcusably killed 8 people, but the system allowed her to get away with it.
Is it Japan where the elderly are actually still treated as people and are revered and valued? The West needs to do a better job.
I think it is, and we definitely do. On that depressing note, that's where we're going to leave it today. Next week, we'll be continuing our series on female killer nurses when we discuss the case of Janine Jones.
All the sources we used for this episode are in the show notes below. If you'd like to suggest a case or theme for us to discuss, feel free to email us at terrifyinglytypicalpodcast@gmail.com. You can also follow us at terrifyinglytypicalpodcast on Instagram and at terrifyinglytypicalpod on TikTok. Leave us a comment below to let us know what you thought of the case. We'd love to hear your opinions.
See you next week.